So dear students, welcome to osteology classes of lower limb. Under osteology classes of lower limb, here is the picture showing all the lower limb bones. So we can see, first we shall name all the bones. So this is hip bone. So the right and left hip bones posteriorly with the sacrum. This is sacrum. Sacrum is not a lower limb bone, it is a part of pelvis. So both the hip bones and sacrum together is a part of pelvis. So hip bone is considered under lower limb bones, and the thigh bone is femur, which is the strongest and longest bone. And in the lower, in front of the femur, the small kneecap bone is patella, and the medial thick strong bone is tibia, which is present in the leg, and lateral bone is fibula, and this is the skeleton of foot. So there are several bones in the skeleton of foot, which we will discuss little later, along with the skeleton of foot. So today's topic of interest is our hip bone. So this is today's topic. So here is the pelvis showing the right and left hip bones joined in between posteriorly with the triangular bone called as sacrum. This is right hip bone, left hip bone, and in between is the sacrum. And lower bones, these are lumbar vertebrae. So the hip bone is a large irregular flat bone, and it is in the region of the hip, so it is called hip bone, and it is formed by the fusion of three primary bones. The three bones are ilium, ischium, pubis. So the upper flat part, this part is the ilium, this part is the pubis, and this part which is well appreciated on the posterior aspect is the ischium. So here is the posterior view to show the ischium. This is ilium, this is ischium, and anteriorly pubis. So these three bones are individual bones. They three fuse to form a single bone called as hip bone. Hip bone present in the upper and lower expanded parts. In the middle, if you see, it is like a constricted part. So we can see individual hip bone here. We can identify it as upper expanded, lower expanded, in between constricted part, and constricted part carries a cup shaped halo which is called as acetabulum. So that is about the acetabulum, and the lower expanded part is triangular, having a foramen which is called as Obturator foramen. And upper expanded part is the ilium here, and Obturator foramen separates. This is the anterior side, pubis, and the posterior, this rough part, this thicker part is called as ischium. The part anterior medial to this foramen, that is anterior medial to the obturator foramen, is called as the pubis, and the part which is posterior inferior to this foramen is called as ischium. So to determine the side of the hip bone, we have to check for the acetabulum. So the acetabulum should be directed laterally, that is towards outwards laterally, and obturator foramen lies below the acetabulum, and the flat expanded part, which is the ilium, that should be directed upwards, and thin pubis is directed anteromedially, and thick ischium is directed posterior inferiorly. So there is a tubercle called pubic tubercle and anterior superior iliac spine. So they both should lie in a same coronal plane. So the pubis, the projection from the pubis is called as pubic tubercle, and anterior end of the upper end of the ilium is called as anterior superior iliac spine. In short, we can say ASIS. These 2 points should lie in a same coronal plane when we keep it in anatomical position. Okay, next we would discuss about each part in detail. First, starting with the ilium. Ilium, it projects upwards from the acetabulum as an expanded fan-shaped flat bone. It is a plate-like bone, and it has got two ends, that is the upper and lower end. And coming to the upper end is represented by a curved thickened border which is called as iliac crest. So this is the, which is not like an end, which is like a thick border called as iliac crest. The highest point of the iliac crest is at the level of L3 and L4. So the highest point is somewhere here. So it is present at the level of L3 and L4. So that is about highest point. And anterior superior iliac spine. So coming to this anterior end of the iliac crest, this is the anterior superior iliac spine. It provides attachment to two structures. One is ligament, the other is a muscle. So the ligament is the inguinal ligament. So it provides attachment to inguinal ligament. And it gives origin to a muscle, provides attachment to a muscle which is called as sartorius, which is the most superficial muscle in the thigh, runs obliquely, called as sartorius. So these two structures gets attached to the anterior superior iliac spine. Posterior superior iliac spine provides attachment to sacrotuberous ligament. So this is the posterior superior iliac spine, which provides attachment to a ligament called as sacrotuberous ligament. The iliac crest is divided into large ventral segment, that is anterior 2/3, and small dorsal segment, posterior 1/3. So if you divide it here, this part of the iliac crest, anterior 2/3 and posterior 1/3. So the ventral segment presents an outer lip, inner lip and intermediate area. So if you see the ventral segment, it is somewhat like this. So here is the anterior end, anterior superior iliac spine. This is the posterior end, posterior superior iliac spine. So this is how it appears from above. So it has got anterior 2/3, posterior 1/3. So it has got an outer lip, inner lip, and between is the intermediate area. So if you see the outer lip, it presents a tubercle that is called as iliac crest, which lies 5 centimeters behind the anterior superior iliac spine. So 5 centimeters behind the anterior superior iliac spine. So the outer lip shows an elevation which is called as iliac crest. Tubercle over the iliac crest. Iliac tubercle. So this tubercle, it provides attachment to the tensor fascia lata. So TFL. So I will draw here. So this part, which lies 5 centimeters behind the anterior superior iliac spine, this part provides origin to tensor fascia lata, which gets originated in front of this tubercle. The outer lip of the iliac crest, it gives insertion to external oblique muscle. So anterior 2/3 outer lip, it provides insertion to external oblique muscle. And latissimus dorsi originates just behind the highest point. So just behind the highest point, we see the attachment of latissimus dorsi. It is also called a swimmer's muscle, and the only muscle which gets origin from the lower limb bones and gets inserted to the upper limb bones. And talking about this intermediate area provides origin to internal oblique muscle along its whole extent. So origin to So this intermediate area provides origin to internal oblique muscle. So these muscles are abdominal muscles which gets attached to the iliac crest. Then inner lip. The anterior 2/3, the inner lip provides attachment to transversus abdominis muscle. So if you see the inner lip, again it is divided into anterior 2/3 and posterior 1/3. And anterior 2/3 of the inner lip provides origin to transversus abdominis. So here is the inner lip. So this is transversus abdominis. So if you see the external oblique, internal oblique, transversus abdominis, these are muscles of the anterior abdominal wall. And the posterior 1/3 provides attachment to quadratus lumborum. So this part here, posterior 1/3 provides attachment to lumborum muscle. Let's talk about the dorsal segment. The dorsal segment is divided by a ridge into inner and outer sloping surfaces. So the inner, what we are seeing here is the lateral surface. So this is like outer surface. So the outer surface, that is what we can appreciate here, is the outer sloping surface provides origin to gluteus maximus muscle. So origin here, this part. Maximus muscle. And the inner sloping surface gives origin to erector spinae. So this part. So this completes the iliac crest. So I'll tell again, iliac crest, anterior 2/3, posterior 1/3. The only muscle which is getting inserted is the external oblique muscle. This is the only muscle which gets inserted into the iliac crest. Anterior border of the ilium, it extends from anterior superior iliac spine till the acetabulum. Means I'll draw a margin here. From anterior superior iliac spine till this level, till the acetabulum, is called as the anterior border of the ilium. Its upper half forms a notch which is lower half projects forwards, called as anterior inferior iliac spine. So now we know already this one is anterior superior iliac spine, and the projection which is down is anterior inferior iliac spine. Anterior inferior iliac spine, it gives attachment to again a muscle and a ligament. The muscle is rectus femoris, and the ligament is iliofemoral ligament, lower part of iliofemoral ligament. Talking about the posterior border, it extends from the posterior superior iliac spine to the upper posterior border of the ischium. So this is the posterior border. So till the upper posterior border of the ischium. So the posterior border extends along the posterior side of the ilium. That is from the posterior, the black lining is the posterior border, and this one is the posterior inferior iliac spine. Posterior inferior iliac spine, when we can see a notch here, this notch is the greater sciatic notch, and the notch below it here, this is the lesser sciatic notch. So this is all about the anterior and posterior border of the ilium, and we can also on the posterior border we can also see the ischial spine, which is crossed from medial to lateral by 3 structures. This projection is the ischial spine, and ischial spine is crossed by 3 structures called as pudendal nerve, internal pudendal artery, and nerve to obturator internus. In short, we can say it as PIN. Pudendal nerve, internal pudendal vessels, and nerve to obturator internus. So that's how we discussed about anterior and posterior. Next, about the medial border. The medial border extends downwards, forwards, medially from the iliac crest to the ilioppubic eminence. So this is the medial border from the iliac crest till here is the medial border of the ilium. It separates the rough sacropelvic surface. So this area is the sacropelvic surface, and anteriorly this is the iliac surface. And lower 1/3 of the medial border, it forms a rounded arcuate line. So lower 1/3, this part from here to here is called as arcuate line, which forms a boundary of lesser pelvis inside. So talking about the surface, first one, this iliac fossa, which is present anterior to the medial border. On the inner aspect we can see. So here the muscle which gets origin is the iliacus. This is called as iliac fossa, which gives origin to iliacus muscle. Next, about the gluteal surface, it is the outer part of the ilium. So the outer part of the ilium is the gluteal surface, and where all the gluteal muscles are getting origin here. So the outer aspect, it is, if you see, it is convex in front and concave little behind, and it is divided into 4 areas by 3 gluteal lines. So this is the anterior side, this is posterior. So 3 gluteal lines, 1, 2. So the 3 gluteal lines are anterior gluteal line, posterior gluteal line, and inferior gluteal line. So these are the 3 gluteal lines present on the gluteal surface. So first, about the gluteus maximus. The gluteus maximus gets origin behind the posterior gluteal line. So this is anterior gluteal line. Gluteus maximus, it gets origin from this area, that is behind the posterior gluteal line. So this is the origin of gluteus maximus muscle. Then gluteus medius, it is between the anterior and posterior gluteal line. So this is gluteus medius. Then the gluteus minimus, it is between the anterior and inferior gluteal line. So this part. So these are the muscles attached to the gluteal surface, and there is one more muscle called reflected head of rectus femoris, that is between the inferior gluteal line and upper margin of acetabulum. So this is the margin of the acetabulum. We can see here. So, and we know this is the inferior gluteal line. So here is the origin of reflected head of rectus femoris. These are the muscles which are getting origin from the outer surface of the ilium. So next we shall discuss about a sacropelvic surface, which is the surface lies posterior to the medial border on the inner aspect, that is the medial surface of the hip bone. So this part is the sacropelvic part. So sacropelvic part is again divided into sacral, this rough part, and this articular part is the pelvic part. And sacral part presents a tuberosity of the ilium, which is behind the auricular surface. And this iliac tuberosity is a rough area which below the dorsal part of the iliac crest, and it provides attachment to 3 ligaments. The 3 ligaments are iliolumbar ligaments. So the structures attached here I am writing and listing here. Iliolumbar ligament, dorsal sacral iliac ligament, Then interosseous sacroiliac. So these are the three ligaments which gets attached to the sacral part, that is the rough part. Then pelvic part, it is smooth and continuous with the pelvic surface of the ischium and form the lateral wall of the lesser pelvis. So this is the pelvic part which is smooth, and most of this surface provides origin to obturator internus muscle. So most of this provides origin to internus muscle, and this is the auricular area, which is an articulating surface which articulates with the sacrum to form sacroiliac joint, which is the most stable joint, synovial stable joint in the body. Now we shall continue with the ischium. Ischium is the thick postero-inferior part of the hip bone, and it consists of one body and the ramus. The body is thick and lies below, posterior to the acetabulum, and it presents two heads, the upper end and the lower end. So this is the ischium. So the main prominent feature of the ischium is the ischial tuberosity. The ischial tuberosity, if we observe keenly, it is divided into upper and the lower part, superior and the inferior parts, by a horizontal ridge. Into upper a quadrilateral area and lower part is called the triangular area. So this ischial tuberosity gives origin to hamstring muscles. So the first hamstring muscle here is the semimembranosus, which arises from the lateral part of the upper quadrangular area. So lateral part. So what we are seeing is the lateral surface of the hip bone. So this is the lateral part of upper quadrangular area, which gives origin to semimembranosus muscle. So next to it is the semitendinosus. Semitendinosus gets origin along with the long head of biceps from the medial part of the upper quadrangular area. So it gets origin here, this part, upper part medially. This is semitendinosus along with long head of biceps femoris. So that is about the attachment. So the lower triangular part, that is the outer part of the lower triangular part, will give origin to adductor magnus. So ischial head, that is the hamstring part of adductor magnus, arises from the lower triangular, that is outer lower triangular part. So this part which I am drawing with purple color is adductor magnus muscle, whereas the inferior and medial part, inferior-medial part, that is this part, which is not given origin to any muscle, this part, it is actually covered by fibrofatty tissue, and it transmits the body weight when we are sitting. So in sitting position, it transmits the body weight. So it doesn't give origin to any muscle. And median margin of the ischial tuberosity is sharp and provides attachment to sacrotuberous ligaments. So what you are seeing is the lateral margin. So medial margin of the ischial tuberosity, it is sharp here, which provides attachment to sacrotuberous ligaments. And next, the anterior border of the ischial tuberosity, it forms a margin of obturator foramen, and obturator foramen, margins of it gives attachment to a membrane called as obturator membrane. So in living, this obturator foramen, it is filled by the obturator membrane. And the posterior border, if it traces with the ischium, it is continuous with the posterior border of the ilium. And it presents a triangular projection called as ischial spine. So this is ischial spine, which is related to pin structures, pudendal nerve, internal pudendal vessels and nerve to obturator internus. The ischial spine on the lateral side, it gives attachment to gemelli muscle, that is the superior gemellus and inferior gemellus. So above to it here is the superior gemellus and lower part it gives attachment to inferior gemellus muscle. So these muscles gets origin here. So superior and inferior gemelli correspondingly they get origin from above and below the ischial spine. The outer surface of the ischium is called as the femoral surface, and this outer surface it gives attachment to obturator externus, which arises from this surface along the obturator foramen. So here is the obturator externus muscle, which is along the obturator foramen. Quadratus femoris arises from this surface, that is the femoral surface, along the lower border of the ischial tuberosity. So along the lower border of the ischial tuberosity here, the quadratus femoris gets its origin. So that is on the femoral side, that is the outer surface. The dorsal surface is continuous with the gluteal surface of the ilium, that is the upper surface, and it is divided by a transverse groove into upper and lower parts, and tendon of obturator internus along with the two gemelli, that is superior and inferior gemellus, traverses through this groove between the upper and lower borders. So here is the groove. This is the groove where the three structures forms a tricipital tendon which runs along the groove. Okay, let's talk about the pelvic surface of the ischial tuberosity. It is smooth and lies between the anterior and posterior border, and it gives origin to the obturator internus. So we can see here the obturator internus gets origin along with the inner surface of the ilium. That is the pelvic surface of the ilium, it gets origin. And the ramus of the ischium, that is the junction between the pubis, this is pubis and this is ischium. So the ramus between the ischium and the pubis is called as ischiopubic ramus. It is a conjoint ramus, and this conjoint ischiopubic ramus, the upper border of it forms a margin of obturator foramen, and it provides attachment to obturator membrane. We can see the obturator membrane attaches to the upper margin, whereas the lower border it forms the lateral boundary of subcubic angle, and it is everted in males. It is more everted in males than females due to the attachment of crura of penis. Okay, let's talk about the outer surface of the ischiopubic ramus. And if you see the outer surface, it is convex. It provides linear attachment to obturator externus. So the muscle here attaches along the margin. This is the next muscle is the adductor magnus. Below to it is the which continues its origin from the inferolateral side of the ischial tuberosity, and it also gives origin to adductor brevis and gracilis. So here is the brevis and gracilis. So these are the four muscles which gets origin from the ischiopubic ramus from the outer surface. So the inner surface, you can divide it into again upper, middle and the lower parts. The upper ridge, it provides attachment to superior fascia of urogenital diaphragm. So the upper part here, superior fascia of urogenital, and the lower ridge, it provides attachment to the perineal membrane and inferior fascia of the urogenital diaphragm, and it also gives attachment to falciform ligaments and sacrotuberous ligaments. So this is the anterior side, this is posterior. So it gives attachment to sacrotuberous ligaments, falciform ligaments, and also it gives attachment to the perineal membrane. So the middle part of the inner surface of the ischiopubic ramus gives attachment to urogenital diaphragm muscles, which are called as sphincter urethrae, and also deep transverse perineal muscle. So the pubis, it is also having the outer surface and inner surface. The outer is the femoral surface and the inner is the pelvic surface. And the body of the pubis, if you see this part, it is quadrilateral like. So this is the quadrilateral part in outline and flattened anterior-posteriorly. And it has got a medial-most elevation which is called as pubic tubercle. So this part is pubic tubercle. And lateral to the pubic tubercle, the elevation is called as pubic crest. So pubic crest is the thickened upper border of the body of the pubis, and pubic tubercle is the projection from its medial end. So what we are seeing is the anterior surface, which is the femoral surface of the pubis. It is directed forwards laterally and it provides attachment to four muscles. So adductor longus, which is a rounded tendon. So already we saw the adductor longus getting origin from ischiopubic ramus. So the same thing, it extends till here. So adductor longus. Next to the adductor longus is adductor brevis muscle, gracilis muscle. So gracilis arises from the lower part and extends further into ischiopubic ramus. So here is the gracilis, and it also gives origin to adductor brevis. So all adductor compartment muscles will get origin from the anterior surface of the pubis, and along the margins of the obturator foramen, obturator externus gets origin, so adjacent to the margins of obturator foramen. Now let's see the posterior surface. Posterior is the pelvic surface of the pubis. It is smooth and it forms the anterior wall of the bony pelvis. So it is called pelvic surface. It is directed upwards and backwards and it is related to the urinary bladder. And medial surface, this is the pelvic surface which we discussed just now, and this is the medial surface. The medial surface forms symphysis pubis, means it articulates with the medial surface of the opposite pubic bone to form a secondary cartilaginous joint called as symphysis pubis. And superior ramus of the pubis, that is the upper ramus of the pubis, it forms superolateral, from the superolateral part of the body of the pubis. It extends laterally above to the foramen, that is obturator foramen, it extends above and ends in the 𝐒𝐿iopubic eminence. So you can see this is the 𝐒𝐿iopubic eminence. And this is the superior ramus of pubis. And it in cross section it appears to be triangular, having a pectineal line on it, and anteriorly it has got the obturator crust, and inferiorly it is has again three surfaces: pectineal, pelvic and obturator and all. So the upper border, this superior ramus of the pubis, this is the pectineal line. So this pectineal line, it provides attachment to lacunar ligament. So I am writing one side. So pectineal line provides attachment to lacunar ligament. Then reflected part of inguinal ligament. And it also provides attachment to the conjoint tendon. Conjoint tendon is formed by the internal oblique muscle and the transversus abdominis. Before insertion, they form the conjoint tendon. And it also gives attachment to fascia transversalis. So these are the structures which are attached to the pectineal line. Whereas the lateral part of the pectineal line gives attachment to pectineal ligament, that is the ligament of Cooper, pectineus muscle, pectineus fascia, and psoas minor muscle if present. So these are the structures attached to the pectineal line. Next, about the obturator crust. Obturator crust, which is present along the anterior border, it extends from the pubic tubercle to the acetabular margin. So here this part, this is the obturator crust, and inferior border of it forms an upper margin of the obturator foramen. So next we shall talk about the obturator foramen, which is a large gap present in the lower part of the hip bone. If you see its shape, it is almost oval and larger in males, and it is triangular and smaller in females. Obturator membrane is attached along its margins except where it bridges the obturator groove, where it turns into the groove into a canal called as obturator canal, and obturator vessels and nerve passes through this canal. So here is the obturator canal, where obturator vessels and nerves will pass through this canal, and the rest of the margins provides attachment to the obturator membrane. Lastly, about the acetabulum. Acetabulum in Latin, it means a shallow vinegar cup. So it appears to be like a vinegar cup, so it is called as acetabulum. So it is a large cup shaped cavity and the outer surface of the middle constricted part of the hip bone. So this is the acetabulum, and it is formed by the three bones, means ilium, ischium, pubis. All of them join, the three parts join in the floor of the acetabulum, and pubis forms the anterior 1/5. So acetabulum anterior 1/5 is formed by the pubis, and ischium forms the posterior 2/5. So ischium forms the posterior 2/5, and ilium forms the superior 2/5. So upper 2/5 is by the ilium. So these three bones joins to form the floor of the acetabulum. Initially during growth, these three bones are joined by the cartilage. Later, after ossification, they all fuse to form a single bone in the floor of the acetabulum. And within the floor, there is a ligament called as transverse acetabular ligament, where we can see a notch here. So this notch is filled by a ligament here. This is called as transverse acetabular ligament, converting the notch into a foramen called as acetabular foramen. Then acetabulum receives the head of the femur to form the hip joint. And the margins of the acetabulum provides attachment to acetabular labrum, which is a fibrocartilaginous rim which improves the congruency of the hip joint, means the depth of the hip joint, bone is, that is the acetabulum, is increased because of this acetabular labrum. Let's see the ossification of the hip bone. So we know that hip bone has got three parts: ilium, ischium, pubis. So ilium, the primary center, it appears during the second month of intrauterine life. So for ilium, it appears during second month of intrauterine life, and for the ischium, it appears during third month of intrauterine life, and for pubis, it appears during fourth month of intrauterine life, and all these with fuses by 18th year after birth. And secondary centers, 2 for the iliac crust, 2 for the Y-shaped acetabular cartilage, and 1 for the ischial tuberosity. So all these secondary centers, usually they ossify by 20 to 25 years after birth, except the acetabular cartilage, which ossifies at the age of 17 years. So this completes the ossification and muscular attachments, features of the hip bone. Thank you.